Hello, this is Dr. Cal and this is Dr. Eric. We're going to be explaining to you the Voodoo band, also called a muscle floss band or muscle compression. It's used for joints in the body. We both see a lot of athletes or even people with just common aches and pains that this compression from the bands can help with. So today we're going to talk about what's going on with Eric's elbow and demonstrate how to use this with your elbow, but it can also be used on your knee, your ankle, your shoulder, pretty much any other joint. So Eric, what's been going on with your elbow?
Funny you ask. Actually, I was carrying a stroller, and the stroller got knocked and it twisted my elbow, so I guess you could do it golfing or playing tennis too, but mine was carrying a stroller. But yeah, my elbow is really tight, especially in this area right here.
Gotcha. So whenever we use the muscle compression band, by the way, these are really easy to get a hold of. You can find them on Amazon for pretty cheap. Just look up either Voodoo Floss, Muscle Floss, or Muscle Compression Band. What you're going to do for, you can do this to yourself, but I'll demonstrate what it looks like whenever I'm doing it for someone. You start away from the heart and work your way towards the heart. Oh, will you hold this for me?
Yeah. Four hands are better than two.
Yes, exactly. Elbows are kind of hard to do yourself, especially if you want to get it on nice and snug. So we're going to wrap this on nice and snug, not too uncomfortable. It does pull on hairs, I'm sorry. Enough to where you're still getting a little bit of blood flow, but it's not meant to be super, super comfortable. We're pretty tight. On a scale of like 1 to 10, how uncomfortable is this right now?
I'd say like a 2 to 3, but okay. I think up to a 5 would be okay.
Yeah, up to a 5 is good. You don't want your hand to turn blue within 30 seconds because we're going to leave this on for about a minute. You can leave it on for longer depending on how comfortable you are with it. I'm wrapping it up and then I'm wrapping it back down. You can just wrap it up around one time. I'm just doubling it for Eric. When you get to the end, like this, you just find a good spot and you tuck it in. Then we're going to go through some ranges of motion. It is really uncomfortable, especially on the inside of the crease. Oop, we lost the band. It is uncomfortable, especially on the inside of the crease, but what this is doing is actually compressing the tissue and helping to get rid of any inflammation in there so that fresh new blood can come in and help the tissue heal. Right? We can put pressure on it. If you're an athlete and you want to get into that front rack position, you can practice getting into the front rack position with that. If you can do handstand push-ups with it, even push-ups, any type of movement to stretch this out as much as possible. Perfect. And then you leave it on for about a minute, minute and a half. Notice he still has a little bit of blood flow in his hands. His hands aren't blue. And then when you take it off, all of this fresh blood rushes in. So this is something that you can do multiple times. I'd say at least 4 or 5 times just to start working through that muscle. Whenever you re-put it back on, it's easiest if you roll it all the way back up like this. Do you have anything else to say about it?
It feels better.
It feels better. It works.